So what is endometriosis?
Yeah, so endometriosis is a benign common condition that happens in women when cells from the lining of the uterus go outside of the uterus and they implant in different locations in the pelvis or abdomen. Those locations could be like the ovaries, the fallopian tubes, different areas in the pelvis, or sometimes even bowel and bladder. And because those are abnormal locations, this will create a lot of inflammation, a lot of scarring, and this is what creates symptoms of endometriosis like pain, abnormal bleeding, and issues with fertility, and so forth.
How do I know if I have endometriosis?
So, really, it's mainly the symptoms. It's what kind of drives us to suspect diagnosis of endometriosis. So, symptoms we'll look at is severe pain with periods, pain with intercourse, pelvic pain in general. Things like that is gonna make us suspect endometriosis, even pain with urination or bowel movements. Once we suspect endometriosis, it's unfortunately we don't have a good test to diagnose endometriosis. The only thing that will give us a 100% answer whether you do have endometriosis or not would be something we call diagnostic laparoscopy, which is a minimally invasive surgery where we do a little incisions in the abdomen, put a camera on the inside, and look on the inside of the pelvis and look at those endometriosis lesions. So we can see endometriosis, we see where it is, and then from there we go on to treat it, remove those lesions of endometriosis, and then we'll send it to the pathologist. They'll look at it under the microscope, and then they can tell for sure whether you do have endometriosis or not.
Okay. If I have symptoms, how long should I wait before seeking treatment?
So that's a great question. So we really say, we encourage women to seek, treatment and help as soon as possible. Endometriosis is a progressive disease. So once you have it, it only will get worse with time. It develops, and that's why the earlier you seek treatment, the better. There is the notion of a lot of my patients tell me that I didn't know that I thought this pain is normal, so I didn't know that I need to come in earlier. So this is kind of with the problem that we're facing right now, is that the average length of time between the onset of symptoms and diagnosis of endometriosis is way too long in the US, with an average of 10 years. So we want to really get this interval of time much shorter so that we can diagnose endometriosis earlier. A lot of women have been told that it's normal to have very, very painful periods. While some pain is normal with periods, the reality is, having to miss 1 to 2 days of work every single month when you're on your periods is not normal. Having to lay on the bathroom floor or being in bed all day while you're on your period every single month, that's not normal. So this is when we say, if you do have any of those problems, seek care, ask for help, speak up, talk to some of your family members, some friends, your healthcare provider, and see how we can help you best.
Okay, so how can Jennie Stuart, OBGYN, help me?
So at Jennie Stuart, we recently initiated a new endometriosis clinic. This is going to be specifically targeted towards patients with endometriosis or with pelvic pain in general. So, and we want to try to make it efficient and easy for patients. So all you have to do is call, get an appointment, tell them what symptoms you're having, and then we'll get you in for an appointment in that clinic. What you will expect on the first visit is that we will go over all your symptoms and your history in detail, see how long you've been having those issues, whether you've had testings before or not, have you seen other providers or not, and then try to make a summary. And then from there we might suggest some testing, we might do examination, and then we'll talk about different treatment options and try to figure out with you what fits your goals best.
Okay, so what would some of those treatments be then for endometriosis?
Yeah, so treatment of endometriosis is really kind of on a case-by-case basis. It's going to depend on the severity of symptoms, your goals in general, your fertility plans as well. Sometimes just medical hormonal management would work best, and sometimes surgery is needed. So if surgery is needed, we always plan for a minimally invasive surgery, and that includes robotic surgery, where we go in again with a camera, small incisions, we try to look for those endometriosis lesions, and then the plan is to excise and remove all endometriosis lesions, and that's to treat the symptoms, to treat the problems that you're having, and then send everything to the pathologist to confirm the diagnosis. So it's not always that hysterectomy is needed. Sometimes it is, sometimes not. Again, it depends on the goals and the fertility situation and everything. So the goal with our endometriosis clinic is to try to make an individualized and personalized treatment plan for every patient depending on the situation.
Okay, thank you, Dr. Toubia.
Thank you.